Hey everyone, welcome back for another deep dive. Now we love to get our hands dirty with some good source material.
And for all of you nursing students out there getting ready for clinicals, this one's for you.
We're going to be tackling upper respiratory infections and laryngectomy.
Two pretty big topics using some real nursing education materials.
So think of this as your cheat sheet to clinical success. We're taking those massive textbooks
And boiling them down to the need-to-know info to help you feel confident and prepared on the wards.
All right, so first up, let's talk about URIs, those pesky upper respiratory infections.
The common cold, basically. We've all been there, stuffy nose.
Sore throat, cough, maybe a little fever.
Yeah.
It's not exactly fun.
But here's the thing. As nursing students, you need to see these common ailments through a different lens. Meaning you can't just assume every sniffle is a simple cold. You've got to think critically.
Okay, so it's more than just asking, do you have a cough?
Exactly. It's about gathering all the clues like a detective. How long have they had these symptoms? Is there a fever? What about their medical history? Any allergies or asthma?
Oh, I see what you mean. Those details could point to a viral infection or bacterial.
And that's crucial for figuring out the right treatment plan.
So, like, if someone has a history of allergies and it's springtime.
You might suspect allergies are playing a role rather than just a random cold virus.
That makes a lot of sense. It's like putting together a puzzle, using all those pieces of information to get the full picture.
Now, while you're gathering those clues, don't forget about the vital signs.
Oh, yeah. Those are super important, too.
Temperature, pulse, respiration rate. They give you a snapshot of what's going on inside the body.
Right. Even subtle changes could be a sign of something more serious.
Exactly, like dehydration, for instance.
Speaking of dehydration, I remember this one time I had a worse cold and I couldn't even swallow.
Oh.
My mom made me drink like gallons of chicken soup.
Ah, the classic remedy. And guess what? As a nurse, you'll be doing the same. Encouraging fluids, maybe suggesting a humidifier to loosen things up.
So we've got all this information about the patient's symptoms and their history. But how do we translate that into actual nursing care?
That's where those nursing diagnoses come in. They sound a lot scarier than they really are.
Yeah, some of them do sound kind of intimidating, like ineffective airway clearance. That always makes me think of someone choking.
I get it, but try to think about it practically. If your patient's airway isn't clear, they might struggle to cough up mucus.
Oh, yeah.
Or even breathe properly. So their body isn't getting enough oxygen, and that's when things can get dangerous.
So how do we help them clear that airway?
That's where your interventions come in. You might suggest a saline spray to loosen up that stubborn nasal congestion.
Okay.
Or elevate the head of the bed to help them breathe a little easier.
And what about those steamy showers? Everyone swears by them when they're sick.
That's actually harnessing the power of humidity. That warm, moist air helps thin the mucus, making it easier to cough up.
So there's the science behind recommending a humidifier.
Exactly. And don't underestimate the importance of basic hygiene.
Hand washing, right?
You got it. Hand hygiene is like your superpower against spreading those nasty germs.
It's like the first line of defense.
And speaking of defense, patient education is key. Make sure they understand why finishing that full course of antibiotics is so important.
Even if they start feeling better before they've finished all the pills.
Exactly. You don't want that infection coming back with a vengeance.
Okay, so far so good. I think I'm getting the hang of this URI thing. Now let's move on to something a little more complex, laryngectomy.
This is where we shift gears from the common cold to specialized surgical care.
Okay, I'm ready.
We're talking about patients who need their larynx removed, often due to cancer.
Whoa, that's a big deal. Their voice box.
Exactly. And that's why preoperative assessment is so critical. You need to understand not just their physical health,
But their emotional state, too.
absolutely, their support system, their understanding of what this surgery means for their life.
So it's really about treating the whole person, not just a physical condition.
Couldn't have said it better myself. And speaking of the physical aspects, let's talk about what happens after a laryngectomy.
Like, what kind of things should we as future nurses have on our radar?
Well, there are a few, but let's focus on two that you might not expect: fistula formation and tracheal stenosis.
Fistula formation. That sounds intense. What is that?
So imagine a passageway forming where there shouldn't be one connecting the trachea and the esophagus.
Oh, wow.
Think of it like a detour in the circulatory system. Things are flowing where they shouldn't be.
So food could end up in the windpipe instead of the stomach.
Exactly. And that's a recipe for aspiration, which can be incredibly dangerous. Now, tracheal stenosis is a bit different. It's a narrowing of the trachea, usually at the stoma site.
The stoma, that's the opening in the neck, right? Where they breathe after the surgery.
You got it. And if that opening narrows well, you can imagine how difficult breathing would become.
Yeah, that sounds pretty serious.
Oh.
So what can nurses do to help manage these situations?
This is where your collaborative skills come into play. Nurses work hand in hand with surgeons, respiratory therapists, speech-language pathologists, even dietitians,
Wow, whole team.
to ensure the patient receives comprehensive care. It's a true team effort.
Teamwork makes the dream work, as they say. But it's not just about managing the physical side of things right. This is a life-altering surgery.
Absolutely. Let's dive into the nursing diagnoses that address the patient's holistic needs after a laryngectomy.
Okay, so we're talking about those labels that help us pinpoint exactly what the patient needs, both physically and emotionally. This feels like a crucial step for planning effective care.
You're exactly right. And this is where your critical thinking skills really come into play. For instance, ineffective airway clearance takes on a whole new meaning in the context of laryngectomy.
That's the one we discussed with URIs too, right?
Yeah.
So it's relevant in both scenarios, but for different reasons.
Precisely. With a laryngectomy, you're dealing with post-surgical swelling, potential mucus buildup, and that new stoma that needs meticulous care to stay clear.
So vigilant monitoring is key, along with teaching patients how to care for their stoma.
Spot on. Now let's think about one of the most obvious challenges, communication. Impaired verbal communication is a common diagnosis after laryngectomy, and this is where you, as a nurse, can truly shine.
I can imagine this being a really tough situation for patients. Suddenly, their primary way of interacting with the world is gone. How do we help them navigate that?
It requires creativity and empathy. You're helping them explore alternative ways to express themselves, writing sign language picture boards, even those amazing electronic devices that create a synthesized voice.
I've seen those devices on TV. It's incredible how technology can bridge that communication gap.
It truly is. And of course, we can't forget about risk for infection, especially with the stoma site being essentially an open wound. Meticulous stoma care and a keen eye for any signs of infection are your best weapons.
Redness, swelling, drainage, those are the red flags we need to watch out for, right?
Exactly. But here's a diagnosis that might not be as obvious: body image disturbance.
So we're talking about the emotional and psychological impact of this surgery. Losing your voice, having a scoma that must be incredibly difficult to adjust to.
It can be a real blow to a person's self-esteem. And this is where your compassion and listening skills come in. Be there for them, validate their feelings, and connect them with support groups or counseling if needed.
So it's about going beyond the physical care and recognizing the profound emotional impact of this surgery.
Absolutely. And then there's the nutritional aspect. Imbalanced nutrition. Less than body requirements is a valid concern, as swallowing can be difficult after a laryngectomy.
That makes sense. If you're struggling to swallow, you're probably not getting enough nutrients. So what's the approach here?
Collaboration with the dietitian is key. You might need to modify their diet, consider thickening liquids, or even use a feeding tube in some cases. The goal is to ensure they're getting the nourishment they need to heal and thrive.
It sounds like caring for a laryngectomy patient requires a whole different set of skills and considerations compared to managing URIs.
It certainly does. But the underlying principle remains the same. You're using your knowledge, compassion, and clinical judgment to meet the unique needs of each individual patient.
That's such an important reminder. But what happens once a patient leaves the hospital? What about the long-term challenges they might face?
Well, think about this. Self-care management becomes super important.
Oh, yeah, definitely. I can imagine.
You're heading home with a new stoma. You're breathing differently, talking differently.
Yeah, it's a whole new world.
So much to adjust to.
So what are the essentials? What does self-care really look like after a laryngectomy?
Well, stoma care is a big one. That's a daily routine.
Right.
Got to keep that stoma clean, change the dressings.
Okay.
But most importantly, knowing when something's not right.
So like recognizing signs of infection.
Exactly.
Yeah.
Redness, swelling, any unusual discharge, those are red flags.
Okay, so it's about giving them the knowledge to be their own advocate.
Spot on. But remember, it's not just about the physical stuff. There's a huge emotional component too.
Right.
They might be struggling with body image issues, communication challenges, even feeling isolated.
It's a big adjustment, like we talked about earlier. It impacts their whole sense of self.
And that's where ongoing support is so important. Support groups, counseling resources, just being there to listen.
Being that empathetic ear.
Exactly. It can make all the difference.
So the nurse's role goes way beyond the hospital. It's about empowering them to live their lives.
Exactly. Now we've talked about the sniffles of a common cold and the complexities of laryngectomy care.
It's amazing how much we've covered.
And hopefully all you nursing students out there are feeling a bit more prepared.
Feeling ready to tackle those respiratory challenges.
Absolutely. But this is just the beginning.
Oh, of course. Always more to learn.
And that's what makes nursing so amazing. It's a constant journey of discovery and growth.
Speaking of discovery, let's wrap things up with that thought-provoking question.
All right, so we've talked about the technical skills, the diagnoses, the interventions.
Yeah, all the practical stuff.
But I want you to think about this. If you were caring for a patient struggling to adapt to life without a voice, how would you help them find their voice in other ways?
That's a good one.
How would you ensure their needs are heard, their feelings validated, their individuality respected?
It really gets to the heart of compassionate care.
It's a reminder that nursing is about so much more than just textbooks and procedures.
It's about that human connection.
Exactly. Recognizing their strength and resilience, empowering them to live their lives to the fullest, even when facing adversity.
What a powerful thought. I don't know about you, but I'm feeling inspired.
That's the spirit. And remember, we're here to support you every step of the way.
Yeah, that's a really important point to consider. What are those long-term challenges that might pop up?
Well, one of the biggest things is self-care management.
Oh, yeah, makes sense.
It's a whole new way of life after this surgery.
Right.
They're going home with a stoma, breathing differently, communicating differently.
So much to learn and adapt to.
Absolutely.
So what are the key things they need to focus on?
Stoma care is huge. It becomes a daily routine, keeping it clean, changing the dressings,
Right.
and knowing the signs that something isn't right.
Like an infection or something.
Exactly.
Yeah.
Redness, swelling, unusual discharge, any of those things warrant a call to the doctor.
So it's about empowering them to be their own advocate.
Yeah, you got it.
Yeah.
But it's not just the physical stuff. Remember,
Oh, right, the emotional side of things.
they might be dealing with body image concerns, having trouble communicating, maybe even feeling isolated.
It's a big adjustment. Like we talked about before, it affects their whole life.
Exactly. And that's why it's so important to connect them with resources.
Like support groups and things like that.
Absolutely. Counseling resources, too.
Sure.
Even just being there to listen can make a huge difference.
Just being that supportive presence.
Exactly. It's about helping them navigate this new normal and regain their independence.
Really powerful stuff. So we've covered a lot of ground today, from the sniffles of a common cold to the complexities of laryngectomy care.
And hopefully you nursing students out there feeling a bit more confident and prepared for your clinical rotations.
Yeah, it's been a great deep dive.
Remember, this is just the beginning. There's always more to learn, and that's what makes nursing so exciting.
It's a lifelong journey.
Absolutely. Now let's wrap things up with that thought-provoking question I always like to leave you with.
Okay, here's with it.
We've talked about the technical skills, the diagnoses, the interventions, all the practical stuff. But I want you to consider this. If you are caring for a patient who is struggling to adapt to life without a voice, how would you help them find their voice in other ways?
Wow, that's a deep one.
How would you make sure their needs were heard, their feelings validated, their individuality respected?
It really challenges you to think outside the box.
It's a reminder that nursing goes beyond just textbooks and procedures. It's about that human connection, recognizing their strength and resilience, and helping them live their best lives, even in the face of adversity.
What a beautiful sentiment and a great way to end this deep dive.
I hope you all feel inspired and ready to take on whatever challenges come your way.
That's a wrap on another episode of The Deep Dive. Thanks for joining us. Keep learning, and we'll see you next time.